we're going to do the Strep A test. This is a dipstick test using a reagent. This requires a nasal oropharyngeal swab. So we're going to don gloves after washing our hands. The items that we're going to need will include the sterile tipped applicator, the reagent strip, the reagents, and the tube. So we're going to give directions for the patient. Go ahead and open up your swab. The patient will be sitting upright. For some patients, this can be a little bit uncomfortable. So let them know that we're going to put the swab in the back portion of the mouth, around the uvula. That's the portion that kind of hangs down towards the center. And we're going to swab both sides. On the count of 3, go ahead and open up. Say ah. Ah. All the way in the back. Okay. Okay, we're going to go ahead and put that into the tube. Add 4 drops of reagent 1 and 4 drops of reagent 2. Being mindful again to keep the caps sterile. Now we're going to take our Q-tip and we're going to mix in the bottom, making circular motions to make sure we've gotten all of the potential bacteria in there. And we're going to take the very flexible plastic container and we're going to squish it as we pull out the Q-tip. That would go into your biohazard container. We're going to open our package. And our reagent strip will sit inside of the plastic tube. It has markings on it. The markings go down. They're like little arrows. Okay. This test will take 5 minutes to read. And as indicated earlier, it would show the same 2 lines for positive, 1 line for negative towards the top, and if it were towards the bottom, the 1 line would make it invalid. Okay, we've waited 5 minutes now. Let's see what the results are. If we have 1 line or 2, we just have 1 line, it's negative, so we can go ahead and discard that in the biohazard container and the tube, and then remove your gloves. And that concludes the Strep A test.